Today's presenter is Temmy Leung. Temmy is a registered dietitian with Washington Health.
Hello, my name is Temmy. I'm a registered dietitian at our outpatient diabetes clinic. And for today's Diabetes Matters, we're going to be talking about driving and diabetes. So there are three main diabetes-related risks among drivers. So first one is hypoglycemia, and some symptoms are dizziness, confusion, weak, tired, headaches, nervousness, seizures, or even fainting. And then neuropathy, which decreases your ability to feel and operate foot pedals, especially if your neuropathy is in your legs. And vision impairment due to your retinopathy, glaucoma, or even like cataract formation. And in terms of hypoglycemia, here's a little chart about the glycemic criteria and description. So level 1 is between 54 and 70. So if you are not feeling a little well and then you're testing your blood sugars, and if it's less than 70, please do treat your hypoglycemia. And we'll talk about that in a little bit. And then level 2 is less than 54. And then level 3 is cognitive impairment, and where you would require assistance to treat hypoglycemia and maybe going to the hospital. And so treating hypoglycemia, you want to first check right away if you're not feeling well or you're feeling low blood sugar symptoms I mentioned earlier. And you want to treat by eating or drinking 15 grams of carbohydrates of anything. And then wait 15 minutes to check your blood sugar again. And if it's still low, treat again. And then have another snack, check until it's okay. And then here are some examples of 15 grams of carbohydrates. So we have half a cup or 4 ounces of regular fruit juice, or 46 ounces of regular soda. Or you can do 2 tablespoons of raisins, around 3 hard or gummy candies, or 1 tablespoon of sugar, honey, or corn syrup. Or you can even purchase glucose tablets, and you would have 3 or 4 of those, or a dose of glucose gel, or a dose of glucose liquids. And then here are just some really common popular brands where you can get the glucose tablets here on the left-hand side. And then in the middle would be the liquids. And then on the right would be the gels that you can buy. And then a little bit on neuropathy. It is more of a chronic or long-term issues, which was caused by high blood sugar levels leading to small blood vessel damage. And so over time, these damages would affect the supply of nutrients and oxygen to these nerve cells, which leads to the loss of mobility, would lead to balance issues, and reduced independence. So lower limb peripheral neuropathy specifically reduces your ability to feel and operate foot pedals, which affects the safety of driving, which makes it really hard for you to gauge the pressure exerted on those clutches and brakes and accelerator pedals. And then medications that treat these neuropathic pain can also have sedative properties. So that's another layer of affecting driving. And then another way to get around it, if you have, lower limb neuropathy, is to have adaptation to your vehicle so you can use handheld controls. So that's like a very extreme case. And then a little bit about vision. So diabetic retinopathy. Some symptoms are blurry vision, seeing spots, floaters, cobwebs, darker empty spots, trouble seeing at night. And so these darker empty spots, this means you have missing vision to see the road, or even like oncoming headlights could provide glare. That could lead to retinal damage from multiple reflections of light inside the eye causing glare. So another way to get around that is to wear tinted eyeglasses. Glaucoma is like loss of contrast sensitivity, which means you'll have problems with glare, light sensitivity, and blurry vision. So, and also like side vision loss. So it's hard to see oncoming traffic and pedestrians. And then for the glare, also utilizing tinted eyeglasses. And then cataract formation, that's just cloudy areas that form on the lens of your eye. So some symptoms are cloudy or blurry vision, seeing double in one eye, seeing halos around light, sensitive to light and glare, trouble seeing at night, bright colors seen faded. So these vision issues would make it overall very hard to drive and affects the overall safety as well. Not just you, but for other people as well, because you can't see them. All right, and then one thing you could do is to carry a medical ID, even on a day-to-day basis, right? So that first responders can have your vital health information, especially when you can't communicate. And then these IDs will list information such as diabetes and other important health diseases, medications like insulin, major drug allergies, and even emergency contact information. So here are a couple examples. One has like a QR code where, they could scan and see. One has a website, numbers, phone numbers, and then the bottom two are a little bit more simpler with just name, blood type, diagnosis, allergy medications, and emergency contacts. So one even has like a doctor phone number and the other one just has 2 emergency contact numbers. And then in conclusion, always carry your glucose meter and have some snacks on you in case you need to check your blood sugars and make sure that your blood sugar is back up before you start driving. Right? Measure your blood sugar before and periodically during long drives, especially if you are more prone to hypoglycemia, right? And then raising your blood sugar if it's below 90, so you can have that buffer. And then safely stop your vehicle, as long as you are having symptoms of hypoglycemia, and then treat as needed. And then keep up to date with your foot and vision checks just to make sure everything is still okay and that doctor says you're okay to drive. Or you can and then ask if you need to utilize in-vehicle hand controls if you're having severe loss of feeling in your feet. And then thank you. And then here are my references.